delighted that you've chosen to come to our open day, and we hope you learn a lot about our institution. Okay, so what do we do here at RCSI? Our largest school is our undergraduate medical school, but we also have schools of pharmacy and of physiotherapy. We're just focused on health sciences, so that's one unique reason to come here.
I really loved the talk this morning. I thought it was really relevant to actually studying and actually being a student here.
Going through first year and now in second year, the different courses and years mix really well. Clubs and societies, literally anything you want to do, there's definitely a club for it here. It's a great place to be.
Some of the things that are different about RCSI from other universities, first of all, it's diversity. I never would have had the same experiences to experience new cultures and make new friends.
My favourite part was the live surgery, so we got to look at that and see what it's actually like to be in the operating room.
So this is where we make the incision, and what we're going to do is get inside the abdomen and then inflate it with carbon dioxide.
We had virtual reality glasses, and we watched the operation and everything. It was so cool because I'd never tried them on before. And then I got to watch everything. It was amazing.
I loved the workshop. They were really good, and I loved the scan of the pregnant lady. I got an overview of how gynecology and obstetrics really are.
Whenever we're looking at any ultrasound scan, so anything that's dense bone is white on screen, anything that's fluid tends to be black.
If you're applying on the CAO for the RCSI pharmacy programme now, what is involved is a 5-year MPharm programme, and this only started, this new programme, in September 2015. And the reason that a new programme was needed really at this stage is the profession has changed vastly. The ability of pharmacists to interact with patients, not just to treat disease but prevent it, is growing. So you learn about the chemistry, the physiology, the anatomy, but also the clinical sciences, the patients, the diseases.
I always had an interest in drug design. One of the really kind of enjoyable pieces about the job is that you interact with so many people. You have engineers, regular scientists, you've the people who are involved in the manufacturing of the drug.
In clinical pharmacy, and I would say pharmacy as a profession, it's all about continued learning. It's something to be really enthusiastic about. It's an area that's going to continue to grow and grow.
I was interested in physiotherapy because I love working with people, and I want to know about human body as well.
I thought physiotherapy is just kind of related to sports, but today I changed my mind completely because there's different topics.
Some of the things that are unique to physiotherapy in RCSI, one of the primary things would be our small class size. We only have about 32 students a year. We also have a state-of-the-art movement lab here. They have an opportunity to have tutorials and teaching sessions with simulated patients. So these are high fidelity mannequins that are programmed to actually talk, and you can actually treat them.
So I suppose if you were to try to define what we do, so we help anybody who has got either injury, illness or disability, and we use things such as movement and exercise. You do a huge amount of anatomy and you learn the musculoskeletal system, the bones, the joints, the muscle.
We did a second workshop today, just at the end of the day, looking at ankle injuries and the chances of ankle injuries being reoccurring, and it was very hands-on. It's very interesting.
So we know that people sprain their ankle by going over on their ankle, the foot going in as the body moves to the outside. So one of the things we do is we put on a stirrup.
When you walked in here, you might have seen there's a new building across the road. It's a €90 million building. It's the most modern simulation facility in the world. It's going to be a fascinating place, and where you can train to be a doctor.
I was kind of interested, but now I'm really definitely interested in it, and I think it's amazing.
A bit of advice for all students going into any university next year, and that's third level education has a lot of opportunities and there's a lot of potential for personal development. The more you put in, the more you get out.